Early warning signs of pancreatic cancer. Hello, this evidence-based content is prepared by Saboor fellowship-trained consultant surgeon, and if you or someone you care about has been wondering about pancreatic cancer symptoms, you're in the right place. I know that when you hear the words pancreatic cancer, it can feel overwhelming and frightening, but knowledge truly helps. Today we're going to talk about the early warning signs that too many people miss, why these symptoms occur, based on where the tumor is located, and most importantly, what you can actually do about them. Before we dive into the warning signs, let's quickly establish what we're dealing with. Pancreatic cancer develops in the pancreas, an organ that sits deep in your abdomen behind your stomach. It has two critical jobs: producing enzymes that digest your food and making hormones like insulin that control blood sugar. When cancer develops in the pancreas, particularly in the cells that line the ducts, it's called pancreatic ductal adenocarcinoma, which accounts for about 85% of cases. Now here's why this matters to you personally. Pancreatic cancer is notoriously difficult to catch early, because the pancreas is hidden so deep in your body, and the early symptoms are often vague and easily dismissed. That's why understanding these warning signs could literally be life-saving. Pain is one of the most frequently reported symptoms, even with small tumors less than 2 centimeters. The pain associated with pancreatic cancer has a very typical quality. It's usually a gnawing visceral ache that starts in your upper abdomen, radiating to the sides and often straight through to your back. The pain is typically insidious, developing over 1 to 2 months. If you're experiencing upper abdominal discomfort that won't go away, especially if it radiates to your back and seems worse when lying flat but better when leaning forward, this is something to discuss with your doctor. Research shows that up to 79% of patients report abdominal pain at diagnosis, and 49% specifically have back pain. The location of the tumor actually affects when pain appears. Tumors in the body or tail of the pancreas tend to cause pain earlier. Jaundice means yellowing of your skin and the whites of your eyes, and it's caused by a buildup of bilirubin in your blood. This happens when a tumor in the head of the pancreas blocks your bile duct, preventing bile from draining properly. About 50 to 55% of patients present with jaundice. If the tumor is in the pancreatic head, jaundice often appears relatively early, sometimes as the first symptom. Here's something that might surprise you. In a patient age 60 or older, presenting with jaundice, the positive predictive value for pancreatic cancer is 22%. That's about 1 in 5 chance. While that means most cases of jaundice aren't pancreatic cancer, it's still significant enough that any unexplained jaundice warrants urgent investigation. If you're worried about someone you love who's developed yellow skin or eyes, this is a medical emergency that requires immediate evaluation within days, not weeks. Weight loss in pancreatic cancer isn't the kind where you're trying to lose a few pounds. We're talking about significant unintentional weight loss. Studies show that 85% of patients experience weight loss at diagnosis, often accompanied by loss of appetite in 83% of cases. The weight loss happens for several reasons. The tumor itself changes your metabolism, you lose your appetite, and your pancreas may stop producing enough digestive enzymes, leading to malabsorption. If you're losing weight without trying, especially 10 pounds or more, over a few months, along with other symptoms we're discussing, this is something to address urgently with your doctor. Steatorrhea means fatty stools, and while it's not the most pleasant topic, it's an important warning sign. When a tumor blocks the main pancreatic duct or destroys enough of the pancreas, your body can't produce enough enzymes to digest fat properly. The result is loose, greasy, foul-smelling, voluminous stools that are difficult to flush. The data reveals that about 25% of patients overall experience steatorrhea, but here's where tumor location matters critically. You might notice your stools float there, unusually pale or gray, and they have an offensive odor. Sometimes patients don't even recognize steatorrhea as abnormal, because they've gradually reduced fat intake as eating makes them uncomfortable. If you're supporting someone through this, changes in bowel habits accompanied by weight loss should prompt medical evaluation. Many patients feel embarrassed discussing this, but it's absolutely essential information for your doctor. Pancreatic cancer can present with sudden onset of diabetes, particularly insulin-dependent diabetes. This is especially significant in older adults without traditional risk factors for diabetes. Here's where it gets interesting. The relationship between diabetes and pancreatic cancer is complex. Sometimes diabetes is a consequence of the tumor destroying insulin-producing cells, and sometimes it appears as an early manifestation of the cancer itself. If you've just been diagnosed with diabetes after age 50 with no family history and you're not overweight, this warrants discussion with your doctor about whether additional pancreatic imaging is appropriate, especially if you have other symptoms we've discussed. About 51% of patients experience nausea and 33% have vomiting at diagnosis. These symptoms can occur because the tumor causes gastric outlet obstruction, or simply because cancer affects your entire digestive system. Loss of appetite, reported in 83% of cases, often accompanies these symptoms. You might find that foods you once enjoyed now seem unappealing, or you feel full after eating just a small amount. If this applies to you, especially combined with weight loss and abdominal discomfort, don't dismiss it as just stress or indigestion. The combination of symptoms is what matters most. Asthenia, or weakness and fatigue, affects a staggering 86% of patients at diagnosis. This isn't ordinary tiredness that improves with rest. It's profound exhaustion that affects your ability to carry out normal daily activities. I know when you hear these statistics it's natural to feel scared, but remember these symptoms are common in many conditions, not just pancreatic cancer. What matters is the combination of symptoms, their persistence, and especially their occurrence in someone with risk factors. Monitor your symptoms carefully. Keep a symptom diary noting when pain occurs, changes in your stools, any weight changes, and appetite patterns. This information is invaluable for your doctor. Know your risk factors. Cigarette smoking increases risk by at least 1.5 times, and the risk fell by 48% just 2 years after quitting smoking. If you smoke, quitting eliminates approximately 25% of pancreatic cancer deaths. Being overweight or obese also increases risk. You already know these are modifiable. Take action now. Understand your family history. About 5 to 10% of pancreatic cancer cases run in families. If you have 2 or more first-degree relatives with pancreatic cancer, or 1 relative plus a hereditary syndrome, you may qualify for screening programs. Come prepared with specific questions. Given my symptoms of abdominal pain, weight loss, and new-onset diabetes, should I have imaging of my pancreas? Don't let anyone dismiss your concerns, especially if you have multiple symptoms. Ask, should I have a CT scan of my abdomen or an ultrasound? For most patients with concerning symptoms, a contrast-enhanced CT of the abdomen and pelvis, or transabdominal ultrasound, is the appropriate first step. If you have a family history, ask, do I qualify for pancreatic cancer screening? High-risk individuals may benefit from screening with endoscopic ultrasound, or MRI, starting at age 40 to 50 depending on their specific risk factors. Seek evaluation within days if you develop jaundice. Yellowing of skin or eyes, dark urine, or pale stools requires urgent assessment. In someone over 60, this has a 22% chance of being pancreatic cancer. Don't wait if you have the classic triad: unexplained weight loss, abdominal pain radiating to the back, and jaundice. This combination demands immediate comprehensive evaluation. New symptoms in high-risk individuals need rapid assessment. If you have hereditary pancreatitis, familial pancreatic cancer syndromes, or new-onset diabetes after age 50 with a family history of pancreatic cancer, advocate for imaging within 2 weeks of symptom onset. Persistent abdominal or back pain, unexplained jaundice, significant weight loss, and changes in your stools are warning signs that deserve immediate attention, especially when they occur together. Your next step, if you're experiencing any combination of these symptoms, schedule an appointment with your doctor this week. This information is for education. Always discuss your individual situation with your healthcare provider. I've outlined several reputable resources here, which you may find valuable for further information on this topic. All links are available in the description below. Thank you for watching.